Hi guys, last video before Le Mans where I officially go AWOL. Beers, barbecues and noisy cars. Cannot wait. So, let's talk about blood tests. What blood tests do you need to do in order to safely and effectively diagnose testosterone deficiency syndrome and exclude reversible causes? And also have a look at your general state of health. So essentially, all the blood tests that are on the TRT Check Plus through Medichecks. So let's go through them. The obvious one, total testosterone. I like my guys between about 20 and 30 nanomoles per litre. However, that is not set in stone, because if you've got low SHBG, you don't need a high total testosterone. And if you've got a high SHBG, you do need a high total testosterone. That would be supraphysiological. But it's not supraphysiological because the high SHBG is mopping up the testosterone, and your free androgen index, your free testosterone, your estrogen, your DHT levels are lower because of this high SHBG. But it's a useful guide. So the BSSM state that you should have a level above 12. Now we all know that that isn't a wonderful marker, not only because obviously you're looking at bioavailable androgens, but also because it's not age dependent, and we obviously know that testosterone drops with age, so you can argue that you would want a higher testosterone than 12 anyway, but for the sake of argument, less than 12. So what else? Your free testosterone, again, that is your bioavailable level of testosterone, which is what your body can actually use. So that's obviously super important. I like my guys between about 0.45 and 1. But again, from a guidelines perspective, you are a candidate for TRT with, I think it's less than 2.25, something like that. What else? Estrogen. Estrogen is super important. It is not the female sex hormone. It is integral to cardiovascular health and bone strength. I don't live in a dodgy area. This is the I think it's a police car. So yeah, it's integral to cardiovascular health and bone strength, also libido, and also mood, because obviously guys with high estrogens do tend to have a problem with anxiety. More than the other typical symptoms of high estrogen that everybody's aware of, anxiety is actually the big one. We're unfortunately a society that has a propensity to aromatization. So when you think about the causes of low testosterone, you've obviously got your primary and secondary and mixed pictures. But I'm 100% sure that there is a subgroup or a subtype of people who really just have a problem with aromatization. That excess aromatization, either through booze, obesity, or just a propensity, so a genetic propensity, or liver dysfunction, is feeding back to the hypothalamus and telling it that you don't need to produce any more luteinizing hormone and follicle stimulating hormone because you've got adequate levels. So our propensity is unfortunately causing a secondary hypogonadism, which is quite scary. So reverse that, lose weight, don't drink, eat a nice clean diet to optimize your liver function, and hey presto. But my God, what would life be without a bit of naughtiness? But yeah, we do have a problem with aromatization. So that obviously led on quite nicely to FSH and LH. So obviously we're aware that high LH and FSH is a primary problem, so a problem with the testicles, and a low LH and low FSH is a problem with the noggin. So that helps us differentiate between primary and secondary. What else? Prolactin another pituitary hormone, obviously super important, not only because actually these symptoms can quite mimic low testosterone. Prolactin is actually super important. So it's super important for inflammation and immunity and sex drive. So you do want to have a nice healthy prolactin level, so not low, not high, healthy. But yeah, the big one with prolactin when you're having a diagnostic workup is obviously to exclude a pituitary adenoma. And that's normally with a prolactin in its thousands, but that's not always the case. So it's super important to know your prolactin level, not only because it mimics symptoms of low testosterone, and there are potentially reversible things that you can do, so medications, etc., that you can address that would reduce your prolactin. But also it's just to make sure that you don't have that issue of prolactinoma, which is, if you get a tumour, it's probably quite a good one to get. If not that any tumour is a good one to get, but I mean, it's a brain tumour, but it's actually not a very nasty one typically. So we've done the primary hormones. So we've done FSH, LH, testosterone, free testosterone, estrogen, prolactin, SHBG. Now, guys who follow the vlog know that SHBG is super important. So it's my big go-to for when I'm designing a protocol, that and estrogen, to have a see what your propensity is to aromatization. But SHBG is super important. As already touched on, high SHBG grabs hold of the testosterone, low SHBG allows it to be free. You don't want to have low SHBG. Again, I've been over this ad nauseum, so I'm not going to go over it. So SHBG is super important. What else? Full blood count. So obviously, for other markers such as infection, anemia, etc., but we're essentially looking at your hematocrit, because TRT is contraindicated in a hematocrit above 0.54. It's very rare for something natural to be above 0.54. I've seen some gear monsters who have come and said that, oh, but actually, yeah, no, it's rare for a hematocrit to be above 0.54 without a pathology that needs to be investigated. Some of the guys that have transferred over from providers and clinics have had high hematocrits because their protocols are wrong. And yeah, it's just unfortunately because the free testosterone spikes stimulate the kidneys to produce erythropoietin, which tells the bone marrow to produce produce red blood cells. I'm already on holiday. So yeah, full blood count super important. PSA. Now we'll do a little separate one on prostate because it's again there's some misinformation and there's some falsehoods going around. So obviously PSA is super important. We do find that optimizing somebody on testosterone replacement therapy normally improves prostatic symptoms, because obviously having healthy ratios of both free testosterone, estrogen and DHT is healthy. What a surprise. Yeah, oh, hello B. So yeah, and again, the prostate cancer risk actually comes from the increased estrogen, which, as we touched on earlier, is a growing problem in society, which I'm sure it's not only the fact we're living older, we've got more people with a propensity to aromatization and a risk of prostate cancer. So when you hear people say, don't worry about estrogen, give me strength. Oh, you don't have to worry about estrogen. Hey. Yeah. Oh, geez. Remove the bros from testosterone replacement therapy. Doctors only, please. Bang, 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 bang. So yeah, PSA. Thyroid's super important to know. Now, most GPs only do a TSH, which has got limited benefit, unfortunately. You really do need to have your T4, your thyroxine, and your T3 levels to have a true appreciation of how your thyroid is functioning. Just obvious things, hypothyroidism, so an underactive thyroid, causes a secondary hypogonadism, It sort of inhibits the release of gonadotrophin releasing hormone from the hypothalamus to the pituitary, and also there's an inhibition of release of LH through stimulation, or not stimulation, from low thyroid. Got to pack up the fags. No, joking. Don't smoke. Hyperthyroidism causes elevated sex hormone binding globulin. So if you can reverse that and you've got high SHBG, do that before going on testosterone replacement therapy. TRT is amazing, but you should only be on TRT if you have a confirmed deficiency and you have done your very best to reverse reversible causes. I say a little addendum to that: if you're morbidly obese, my God, you know, I can't tell you to lose 7 stone. Oh God, there's an old woman and man stood there. Go away. So yeah, you need. God, you walk on. God, what are they doing? They're looking at my. I always do some stupid graphics for the back of my car when it's Le Mans. So I've done a quote from Mad Max. I am the Knight Rider. I'm a fuel-injected suicide machine. I'm a rocker. I'm a roller. I'm an out-of-controller. Yeah, just boys, whatever. We'll dick around. So yeah, thyroid is super important to know. You also want to know things like your liver function. As already discussed, liver function is super important for aromatization, and obviously your liver detoxifies everything. So you need to have a super healthy liver. Now, blood markers unfortunately aren't wonderful. To actually really optimize or diagnose your liver, you need to have a fibro scan. But LFTs are LFTs, so they are still good indicators, but they don't tell the true picture, unfortunately. Kidney function, obviously you excrete everything via the kidneys, so it's important to know kidney function. Lipids and cholesterol, so obviously testosterone can decrease HDL, which is the good cholesterol, but that's normally from over-aggressive protocols. And you also have to remember that cholesterol is the precursor to pregnenolone, which cascades down to cortisol, aldosterone, and testosterone. So, eggs. I love eggs. So yeah, it makes sense to me that you don't really want to tank your cholesterol. You just want to make sure that your HDL is good and your LDL is down. So, what else? Have I covered everything? Have I missed something with my distraction from the old punters looking at my motor? So we've done the hormones, we've done liver, including SHBG, we've done full blood count, we've done PSA, we've done thyroid, we've done kidneys, lipids. I think that's it. So essentially, you do need to have a proper diagnostic workup. An isolated total testosterone is almost pointless. It's good as a screening thing, but I mean, if you're still symptomatic and clearly you've had a blood test done because you're symptomatic, you do need to have a full workup. It allows me to obviously look to see if there's anything I can recommend and potentially fix before thinking about testosterone replacement therapy, and it also excludes any contraindications, etc. So yeah, the TRT Check Plus from Medichecks covers all the diagnostic blood tests that you need to safely and effectively diagnose TDS. So yeah, I think that's it. Right, I'm off to go and get eat and party. Right, cheers guys. Ta-da.